All right, good morning. This is Ben Steffen at the Maryland Healthcare Commission. Welcome commissioners and staff. Before we begin, I think we'll just do a quick roll call here, checking who's in the room with me, starting from my left.
Good morning, everyone. This is David Sharp, staff to MHCC.
This is Steve Port, staff to HSCRC.
Lenny Preston with the Maryland Women's Coalition for Healthcare Reform.
Teresa Lee, MHCC.
Vinnie DeMarco, Maryland Healthcare for All Coalition and Consumer Outreach Task Force.
Okay, and on the line, who do we have? Can they hear? Can they respond?
Yeah.
Commissioner Weinstein?
Maybe muted.
Yes, Commissioner.
No, he's unmuted.
Can you hear me?
Yes. Thank you. Commissioner Phillips?
He was the only one that.
Okay. We have others that are expected to join. Our attorney may also be on, although I'm not sure. So let's begin. I want to first of all thank Lenny and Vinnie for agreeing to present today. I also want to recognize the work that Teresa Lee did with Diane Feeney in serving as staff representatives and co-chairs to the Consumer Outreach Task Force. That was convened beginning in January of this year to begin to work with the community to educate, develop strategies for educating and engaging communities in Maryland in the new hospital payment model, as well as other initiatives that will evolve or develop as a result of the launch of the new model. We have the work group decided to really break into two groups, one focusing on literacy and consumer engagement, the second focused on communication strategy and measurement. And I think we've been fortunate that both of the leads on those two dimensions of the report to HSCRC are here today. We'll begin with the presentation by Vinnie DeMarco, who is head of Healthcare for All. Many of you know him, and he will talk about the Consumer Outreach Task Force report, one of the two reports that came out of this engagement initiative. So why don't you begin, Vinnie?
Thank you very much, Ben, for having me here, and Teresa and Steve for all the great work you all did help us get to where we are. As Ben knows, I presented this report yesterday before the Medicaid Advisory Committee, so Ben got a preview yesterday. We are thrilled at Healthcare for All to be part of health system transformation in Maryland, and I know that all of us involved with this process really thank Donna Kinzer, Steve Ports, and everybody at HSCRC for being so open to consumer input, consumer involvement, which is absolutely wonderful. And so let me tell you what we did with the Consumer Outreach Task Force, working very closely with Carmela Coyle, Maryland Hospital Association. We decided that the first thing that needed to happen is to reach out to the people of Maryland and see what they think of health system transformation. And so to do that, we held a series of 11 forums across the state. And the task force will start with a description of the forums. So the forums were such that at each one, we had a local host welcome, and then we had a presentation by a representative of the HSCRC or the Maryland Hospital Association. It was mostly Steve Ports. Steve did most of them, and it was great. But Donna Kinzer did some, John Comers did a couple, Carmela Coyle, Dave Romans, and they were all terrific, describing what health system transformation is about in Maryland. Then we had a panel of local stakeholders, hospitals, health officers, community leaders, talk about what's happening in that local community on health system transformation. And then we did a presentation about the Faith Community Health Network, which I'll talk about a little more later. and that was followed by questions and answers by the community in the room, and then evaluations. We asked for evaluations. So we just take a picture at each one, and as you could see from these pictures, we had a broad diversity. We had 11 forums from the Eastern Shore of Western Maryland, all across the state, and there were over 800 people at all of them together, people who really represented a broad cross of Maryland citizens. And as you can see, 40% of them or more filled out the evaluations, which is a good amount because people hate evaluations, and I'm one of them. But people were very interested in doing these evaluations. The presenters, of course, as I said, included the HSCRC people. One of my favorite forums was one Steve came at in Prince George's County, hosted by Collective Empowerment, which is the main faith organization in Prince George's County, and we had hospital folks and everyone else. And the benediction at the beginning was done by a pastor who talked about, used a scripture verse about a new song. And Steve told us about his singing abilities after that. New song, new day, that's our message. The new day for healthcare in Maryland. The attendees include, well, let me just start with the presenters again, included top hospital leaders all across the state, hospital CEOs, top population health people. So the hospital community is very much engaged in these forums, along with health officers in most of these areas. The attendees were 800 people who represented, I believe, the state of Maryland. We have over 750 faith, community, labor, healthcare, and business groups in our coalition, and we worked hard to get representatives from those coalition partners at these forums, people who really could then go back to their communities, and of course faith leaders go back to their communities. SEIU 1199 and ARP and NAACP worked very hard to get people to these forums. So it was very well attended, and the people were engaged. That was the great thing about it. The people who were at these forums really appreciated that we were there and really were engaged in the Q&A and the evaluations. So what did we learn there? That first of all, people did not know very much about health system transformation, and you know, Steve and the other original presenters did a great job of talking about this complicated topic in a way that consumers can understand, and that was assisted by some focus groups which we commissioned, which did a really good job of helping all of us figure out how to talk about health system transformation. People made clear that they and the members of their organizations want to know about this, want to know about it before hospitalization. They want to know what's going on, not only statewide but in their community, what it means for them, and they want to make sure that it's consistent, that health system transformation is consistent between hospitals or local providers, FQHCs, and everybody else in their community. We asked, you know, where do you want to learn about health system transformation? And a lot of people said from their primary care providers, and we intend to follow up on that, and with faith leaders, and I'll talk more about that. They also want to hear about it and know their constituents want to hear about it through traditional news outlets and through social media. These were lessons that we learned from these forums. We have a full report, which I think I sent to you all, and the members of the commission may have, a full report about our task force, and we have a more in-depth analysis of all evaluations. So if anybody wants to see those, just let us know. We can provide that. But this was a tremendous opportunity to get feedback from the people of Maryland on health system transformation. Our report, it's actually on page 10 and 11 of the report, has 5 recommendations, which we are in the process of operationalizing with a budget. And we plan to get some funding, like the funding, I should say that the funding for what we've been doing so far, the forums, the focus groups, the Faith Community Network, has been from private foundations, national and local foundations who are very interested in this, and we intend to go back and get additional funding to carry out our recommendations. with working closely, of course, with HSCRC on how that will be done. So the first recommendation is that we build on the success of these forums. These are 800 people who want to be involved in health system transformation, and each of them can reach many, many other people. So we should go back to them after a while and maybe have a follow-up forum where we say, well, what's happened since the last forum? And and we can have another presentation by people at HSCRC and local hospitals about what's been going on since, and hear from the people about how it's affected them. I think that's very, very important. There was a lot of interest in that from the people at these forums to do it again and to keep following up with them. And in addition to additional forums, really keeping in touch with the key stakeholders who came to these forums. Second, we urge to continue to give a voice to consumers in the transformation of in health system transformation. We again appreciate very much Don and Steve and everybody at HSCRC making that happen, and we're here to help that continue. Again, we have a coalition of over 750 state, community, labor, healthcare, and business groups representing hundreds of thousands of Marylanders who we can help to get into this process going forward. Third recommendation is Dynamic Faith Community Health Network. I don't have a lot of time to go into this, but before we started the Consumer Outreach Task Force work, a group of us went to Memphis and found an incredible program there that's been going on since 2006, where the local hospital works with 600 local congregations to keep people healthy. And there's a lot about it on our website, healthcareforall.com. Basically, the hospital identifies a paid staff person to work with congregations. The congregations have volunteer liaisons, and together they work to keep people healthy who are who come to the hospital from the congregation. And it works. Memphis Hospital tells us that they spend $600,000 a year on the program, and they believe they save $4 million a year. And they've seen dramatic improvements in healthcare among people in these congregations. We came back from Memphis committed to making it happen here, and I'm very happy to let you all know that we have a pilot project happening as we speak with LifeBridge Health, Northwest, Sinai, and Carroll hospitals. They are big time into this, and we are working with them and many, many faith groups in the LifeBridge area to make this work there. And we have a big day coming on January 18th, Martin Luther King Day, where we're going to train many, many liaisons from local congregations on how to work with LifeBridge Health. After this works there, which I believe it will, we are hopeful that hospitals all across the state will also institute faith community health networks. We've talked with CEOs of St. Agnes and Bon Secours, hospitals in Montgomery County, Prince George's, all across the state, and there's a lot of interest. Anne Arundel, Frederick, everywhere. And I know that Carmela Coyle is very, very excited about this project to have the Maryland Hospital Association help us spread the word. Two major differences between what's happened in Memphis and what's happening here I want to emphasize. One is, in Memphis, the hospital did everything, soup to nuts. Reached out to faith leaders, trained the liaisons, and the hospital work. We're doing most of that. We're doing a lot of that here. We're doing the reaching out to the faith leaders and training liaisons, which the hospital likes. It's a good partnership, and that's the model we want to use around the rest of the state. In addition, we're building on Memphis to not only help people when they're in the hospital, but before. Carolyn Katraki, the Maryland Health Connection, loves this campaign, and she is working with us to train these liaisons on how to enroll people in Medicaid and qualified health plans, and maybe even make them application counselor supporting entities. There aren't any congregations in the country doing this, but we think we're going to have some in Maryland, in the first congregation in the country where the congregation can actually enroll people. And Carolyn loves that, and she's going to be part of this program. And we're also going to be working with the liaisons on how they can keep people healthy, stop smoking, but other kinds of ways that they can be healthy and stay out of the hospital. And, of course, LifeBridge loves that. So we'll talk to you more about Faith Community Health Network. The other is, as we learned from the forums, people want to hear from their primary care providers. So we're going to work closely with MedChi and other physician groups and provider groups, nurses and everyone else, to make sure that they help their people understand what's happening with health system transformation. And finally, for questions, we want to maximize communications with consumers through traditional and new media. And we have ideas for a radio campaign and other social media to get the message out. And we believe that one of the best ways to get the message to consumers about what health system transformation is about is through the Faith Community Health Network. Have a talk to the people, show Marylanders how hospitals are working with faith leaders to keep people healthy. And that, I think, is a good way to introduce health system transformation to people as an example of what's actually happening. And of course, we want to build on that for non-faith communities to try to implement something like the Faith Community Health Network in secular communities also. But the faith community is ready to go, and I think that with them, we can not only help those congregations, but also the broader public with health system transformation. So to summarize, one of my favorite lines from the focus groups we held was when this woman was asked, what do you like about health system transformation as described? And she said, I like that it's proactive, not reactive. And I think that's what we're all about, and that's what our forums have been about in the Faith Community Health Network. And I think working with the HSCRC, we can, and MHCC, we can make this work. So that's all I have, and I'd love to answer questions.
Thank you, Vinny. Let me check here. I think we have time for a couple questions. First, any commissioners on the line? So I have one.
That sounds like Glenn Schneider.
It is indeed. Hey, Vinny, I just had one quick question. You know, most people will not be experiencing healthcare transformation directly because they won't necessarily be going to the hospital, and they might not know anyone who is going to the hospital. So how do we do a job of making sure that we're targeting our educational efforts to those who are most likely to be there? And then secondly, I just want to add a comment. I was at your first forum in Howard County, and we had probably 120 people there, and it was a very energized conversation, and people definitely want to be involved in knowing how their lives might change. But truly, if you could answer the first part of the question, that might help.
Yeah, no, thanks, Glenn. I mean, we think one of the best ways to do that is through the Faith Community Health Network. Through that network, we will reach out to people who are going to the hospital, many of whom didn't have anybody who can help them in their community. And now, through the Faith Community Health Network, we'll have someone working directly with the hospital who can help keep them healthy. Pastors have told us, and rabbis who we talked with about this, that one of the things they love about the Faith Community Health Network is that they often don't know when someone in their congregation is in a hospital until it's too late. But now they will know right away. So a lot of these people, Glenn, who had never heard of health system transformation, don't know it's out there, will, through the Faith Community Health Network, be engaged in it and part of it, and we will help them. In addition, since we're building on the Faith Community Health Network to keep people healthy, to get them enrolled in the Affordable Care Act and teach them about health prevention, we can help keep people out of the hospital. I think this is the best way to move forward and reach the people you're talking about. And of course, once it's happening, we very much want to build that to secular communities that could do the same thing. But I could tell you our partners like AARP and SEIU, who have a lot of seniors in their membership, are thrilled about this and are going to work with us to make it happen.
That's fantastic. Thanks a lot.
Other questions?
This is Commissioner Stollenberg. I have a question.
Hello.
Go ahead,
Hello.
Commissioner.
Very, very, very pleased to hear this update. One of the things that, well, I have two questions. One has to do with, and in some ways this is tagging off of Commissioner Snyder's comment about not everybody goes to the hospital. With the waiver and the health system transformation, one of the things that we at MHCC talk about quite a bit is the connections that are incentivized and expected and frankly assumed, the connections that are assumed to be essential between hospitals, long-term care providers, primary care providers, and others. How how does that factor in here? It's not all about inpatient hospital care. So what are the efforts around helping people to understand connections and coordination that should be happening and how their lives will benefit from that coordination?
So just before I begin, Commissioner Snyder, I think you're not on mute, and we're hearing some side conversations. Maybe you would like us to, but just to give you a heads up that we're hearing your sidebar conversations. So,
which I always enjoy.
Go ahead.
Thank you, Diane, and thanks, Diane, for your helping setting this up here for us. I again think that the Faith Community Health Network is a great way to address what you're talking about. What we will do is train the liaisons at these congregations to know what's in their community that can help their congregants before they go to hospital and after they're out of the hospital. We want to work closely with FQHCs and MedChi so that the liaisons know where to refer someone when they come out of the hospital, and in addition, what is available in the community to keep people healthy so they don't end up in the hospital. And as I said earlier, we heard loud and clear from the people who came to our forums that they want to hear more about health system transformation from their primary care providers. And I assume that also includes certainly FQHCs and other people in the community who provide care. So we're going to work with their organizations so that they can provide this information to people directly. So in those two ways, through the Faith Community Health Network and by working with the state organizations of community health providers to get the message about health system transformation, I think we can address the problem you raised.
So thank you. My second question has to do with terminology. It would be great to get advice either now or at sometime in the future about how we can most effectively talk about this. Too often this is referred to as the waiver, or even health system transformation. I can just imagine any number of people's eyes glaze over, not having any idea what that means. So how can we as a commission, how can all of us in a coordinated way talk about this? And I would include the hospitals. Hopefully you're working closely with the hospitals because they really hold a lot of the power in terms of that coordination happening. How should we all be talking about this so that the public understands what we're talking about?
It's a great question, Diane, and we, as I said, commissioned these focus groups from one of the top pollsters in the state, Steve Robbie from OpinionWorks, who put together a great analysis that we can share with you, and I would encourage you sometime to have Steve make a presentation to you all as he's done at the HSCRC and at the Maryland Hospital Association. The basic message in the focus groups is don't say words like waiver, health system transformation, and certainly not global budget and fee-for-service. Forget all those words. What to say is it's a new day for healthcare in Maryland. Hospitals are now working to keep people healthy. And that's the message people understand. And that's why I believe so much that the best way to communicate with the public is by a specific example of how hospitals are keeping people healthy, which I think is the Faith Community Health Network. So when we unveil that, we are going to say this is the new day in healthcare, where hospitals are working together with congregations to keep people healthy. And I think the public will understand that something new is happening. I'll tell you a quick story that I was doing a radio interview in Washington about other health issues, and somebody asked me what's going on in Maryland and on healthcare and I forgot Steve's advice or wasn't listening to him and started saying things like global budget and fee-for-service, and immediately the reporter went down my throat about aren't people going to be denied care at the end of the year and all the rest. It was a terrible interview. The second interview, I remembered Steve's advice and started with, it's a new day for healthcare in Maryland. Hospitals are working with communities and congregations to keep people healthy. And the interview was great. And I was able to talk about the specific things you're doing. So you're right, Diane, that what we say is very important. And take all those technical words out of your lingo and say a new day for healthcare in Maryland.
So I think we can have one more question. I have one, but if a commissioner has a question, I'll pause here. Any others? So I assume that this cost this is going to have some cost impacts to it. Do you have an overall budget for your for the initiatives that you're suggesting? I know that some of our commissioners are very focused on these other investments that need to be made as a result of the new hospital payment model, and I wondered if you tried to work up what these might cost.
Well, we are working on that as we speak. We are been talking closely with Steve about this, and we're working up a budget to implement each of those 5 recommendations. We think it'll total be about $450,000, but we don't have exact yet. And we intend to reach out to foundations like we did in the past to raise most of that money. There are foundations in Maryland and across the country very interested in what's happening here, and they funded our focus groups, our forums, and the Faith Community Health Network. Let me just say about the Faith Community Health Network, and this is not included in that $450,000. We just got a grant of $144,000 over 2 years from the ABLE Foundation to implement the LifeBridge pilot. And we're waiting to hear from 3 other foundations that would together give us the money we need to fully do the LifeBridge project. So it's a project that you're right, it takes money, but I think we can raise it and do it.
Okay. Thank you. I think we will have several questions at the conclusion of Lenny's presentation about how activities that the MHCC is launching can integrate with what both of you are doing. But I'd like to give Lenny a chance to complete her presentation. If you pass the clicker on. Lenny Preston is head of the Maryland Women's Coalition for Healthcare Reform. She's a frequent speaker on healthcare reform before the Maryland Health Benefit Exchange. I know that well. I see her often, and I find her as a very thoughtful on approaches for engaging consumers broadly in these new initiatives, both specific to Maryland, but more broadly, healthcare reform that's being implemented across the country. I know that her work group focused more specifically on measurement, but I'll let you hear directly from her on what they envision doing to contribute to these initiatives here. So go ahead and welcome.
Thank you very much, Ben, for the invitation. And yes, I'm not a quiet voice, so I do believe in speaking up and speaking out and helping consumers do that as well. So, and pleased to follow Vinny, because I think the work that we led with the Consumer Engagement Task Force really put some meat on the recommendations that his group came up with. And I hope that actually some of what I present will respond to the questions that both Glenn and Diane had. So I put in a number of slides that I'm not going to spend a lot of time on, but that just you'll have for future reference. And of course, the report is available. And I would say that in the appendix of the report provides some specific strategies that aren't in the report itself. So it's useful to go and look at that in total, but I've tried to put some of that in here as well. So the coalition was founded in 2006 to bring the voice of women and men to the goal of advancing health equity through access to high quality, affordable health care. Today, I want to talk about the work of the task force, how we went through the process from January to September, 9 months. I thought it was easier to have 2 babies than get through this, but we did it with monthly meetings and meetings every 2 weeks in between. And so I'll go through the recommendations in the report, and then as Ben suggested, I'd like to at the end sort of circle back and just give you some ideas on how the work of HSCRC and MHCC intersect so beautifully. We did have a real diversity of members who stuck it out through the 9 months and contributed enormously. Nobody contributed more to the process, I would say, that Diane Feeney and Steve Ports at HSCRC and Teresa with MHCC. We really could not have gotten to where we did in the end, which I think are some really substantive recommendations. And let me say that the first phase, really, we did some research. We brought in Lynn Quincy from Consumers Union to talk about the research that they have been doing on a national level, and they also did one of their focus groups in Maryland, so that was invaluable. And Teresa took 3 areas that we had identified as critical for consumer engagement that we wanted to know more about at the hospital level: consumer rights and protections, the complaint process, and advisory councils. And so Teresa and her team did a survey of the 46 hospital websites to see how easy it was for consumers to get information in those areas. And on the consumer rights end, 39 of the 46 hospitals had pretty good website information on this. The complaint process, 26 of 46, so not so great. And on the PFAC, the advisory council level, only 7 of 46 hospitals could you actually find information. So it was clear that we had a lot of opportunity. So the task force really had 2 charges. One was ultimately to create a consumer communications strategy focused around the new all-payer model, and let me speak to that. In our deliberations, I described it as really needing a sexy name for this little project that we've got in Maryland, and we didn't come up with that sexy name, but we do believe a statewide campaign is necessary, and that as a product of that, we'll get to that sexy name. The second charge, I think, is equally as important, which is to look at the consumer feedback loop, which we described as concerns, commendations, and complaints, and see how challenging it is for consumers to go through that to get information on it, and then what happens to the data at the end of it. How can we make sure that that data is effectively aggregated and used, available to policymakers, to consumer advocates, and others to inform policy and improve the model going forward. I never talk about any of this unless we make sure, as we did in the task force, that we recognize that none of the initiatives that Maryland is working on works in a silo. They are like a jigsaw puzzle, and if we don't put the puzzle together right, we're not going to be successful in the end, because the success of each of these and many others depends upon how well we do in other areas. So one of the first things we did was to define consumer engagement, and then came back to that at the end. So we said engaged consumers are those who actively participate in their own health care, and more broadly in health policy, planning, service delivery, and evaluation at service and agency levels. And I'll talk about this a little bit more. I think we would all find it very optimistic if we just got to the first part of that, patients engaged in their own health care. But we see a path to consumer engagement. You don't just drop people in at the end of consumer engagement and expect that they're going to be doing a great job. We all know what an incredible challenge we have with health insurance literacy. Only 12% of adults have average health literacy. So nearly 9 out of 10 actually lack the skills now to manage their own health, much less to pick the right insurance plan. And we know that minority populations have a greater challenge with this than others. So that's the first step, is getting us through health insurance literacy. The second step is health care literacy. So what do people do? They get their insurance card, but what the heck do they do with that little piece of plastic? We have to make sure that they know how to use it. And we know that's a challenge after first 2 years of open enrollment and what we're seeing on the ground. So when we get through those 2 stages, we're then at a point at which consumers are sharing decisions with their providers. They are engaged in their own health care. They know how to keep themselves healthy. And in the best of all worlds, they are engaging outside their own room with others in their community. So the example I use is Anna Brown has done well. She's had surgery, but she's on the mend. She has a primary care provider. She knows what to do. And she looks next door at her neighbor who's got diabetes and asthma, and there's no bus route. He has no car. He has no way to get to a doctor. So Anna says, what can I do to help this situation? That's a truly engaged consumer. So that's where we would like to get. We defined how consumer engagement can actually benefit consumers and the community. I won't go through these. You know all of those. But we then looked at how can it benefit healthcare providers and institutions, because we need to get buy-in from the key stakeholders in order to engage them effectively in engaging the consumers broadly and their own patients in particular. So, and we looked at some really good examples of how this is being done, for instance, at the Anne Arundel Medical System, and I can talk about that a bit more. I come from a strategic planning background with nonprofits, and so I live and breathe vision and mission statements. And we did come up with a recommended mission, broad mission that can be embraced by all.
A few seconds ago, yes. How are you?
We are picking up someone's feedback from your phone, so please mute if you can.
Thank you. So to foster a healthcare system that's driven by a culture of robust and meaningful consumer engagement. Meaningful is so important. It's not good enough to check off a box and say, oh yes, I did consumer engagement today. It has to be impactful. And taken as a whole has to address the triple aim. So we used that as a guide as we went forward. And we came up with, as we were doing our research phase over several months, some themes that ran through everything. I think the single most important one is that there's a clear call to action. This we heard from Lynn Quincy when we first started the work, and not only a call to action, but it has to be at the right time, in the right place, and from the right person. Mm-hmm. Consumer engagement, individuals have to understand that their impact is having, their input is having a meaningful impact. And we have to understand that individuals' motives are different than those from institutions.
This is very hard.
So, excuse me, someone has their phone, has unmuted their phone, and we're hearing your conversation. If you could please put your phone on mute, we'd appreciate it.
Thank you. So another point just to stress on this, and we can come back to these, but there has to be a commitment from healthcare leadership at all levels, from the top down. And we did include the need for advanced directives planning as a part of this. I think it's important to remember that as this Consumer Engagement Task Force looked at this, I had to personally wear blinders and remember that we're working with HSCRC on the all-payer model and not on the big picture, so to speak. So we came up with two specific goals. Of hospital services in their own health care in order to promote efficient and effective use of the system. You've all seen this triangle in other forms, and I think this goes to what Glenn and Diane were asking about. So we took the traditional triangle and broke that out into the prime audiences with our high utilizers at the top, and then broke those down based upon the messages that they should receive and the optimal messengers, because I can tell you from an unfortunate personal experience that perhaps the hospital itself is not always the best messenger, but there are many messengers. And go back to the idea that that call to action has to be at the right place at the right time with the right messenger. So there are multiple opportunities here. And we built upon general messages for the general public because we want to keep people from becoming the high utilizer. So they're very broad messages that we need to develop through a statewide campaign, and those become more refined as you move up the triangle to the high utilizers where you need very targeted. They're solely focused on their particular problem at that particular moment. And again, in the report, in the appendices, you'll find that we have many more messengers that we have identified there. We then looked at or set out a series of recommendations And again, strategies to implement these are in the report. So you can really go through these at your leisure, but meaningful ongoing role for consumers at HSCRC. So ensuring that there is continued and ongoing representation of the consumer perspective. And we also recommended the creation of a standing advisory committee along the lines of the one that the exchange has put in place, which I serve on and Vinny also serves on. So we know how well that can work. Obviously, collaboration with key stakeholders to develop a statewide public education campaign, a very broad one, health and wellness campaign, and then one specific to the all-payer model. So the concept is that we have the broad, what I call Get Healthy Maryland campaign, and within that construct you have specific messages, whether it's for the exchange with enrollment or whether it's with the all-payer model. We also recommend to do this work in interagency task force with consumer representation, created through a liaison with the Standing Advisory Committee to develop the campaign and to work on other agenda items. Opportunities for regular, longitudinal, effective consumer engagement in the development of policies. And number 5, in coordination with the Standing Advisory Committee, one of the areas that we looked at was creating a consumer gold star rating for hospitals, and that would specifically look at least as defined at the moment, and this needs work, the consumer rights piece, the complaints process piece, and that piece around advisory councils. But we think this is a way to push this agenda forward. We do believe that community benefit should be for the benefit of the community, and so recommended that HSCRC actually define what consumer engagement is within the context of community benefit. Continue to encourage those independent collaborative approaches. The regional transformation grants are a terrific start in this effort. Obviously, as consumer advocates, transparency is absolutely critical, and MHCC has done a terrific role in this area with the quality reports. We just put a link to that in our most recent weekly e-letter to ensure that people know that that is there and a resource. And then, again, to include discussions about patient and family decisions around the end-of-life discussions. So looking at the measurement piece, we really relied heavily upon Diane and Teresa for this. We looked at the metrics that are there now, the existing sources, resources, as well as some we might look to at the future, such as the Communication Climate Assessment Toolkit that's not now in use, but there are elements of that that we might be able to roll out on a rolling basis. And then proposed others such as the creation of the HSCRC Standing Advisory Committee, the effectiveness of its work, and then also the patient, family, and advisory committees at the hospitals. We've said that this is a multi-stakeholder, multi-agency project, and that it does provide tremendous benefit. We need to define that benefit, as Vinny discussed and has been suggested. We need proactive and committed leadership. HSCRC knows that the report that we handed them is not going to sit on their shelf, and it's imperative that HSCRC embrace a continued leadership role. I will say that it's really exciting as an advocate to be in Maryland with a model project that is also a model for consumer engagement. We really are setting a standard here, and I'm actually going to talk about this on the national call next week, so there's a great interest in this. The intersection with MHCC, I told you I did strategic planning and I love visions. I was really excited to read MHCC's vision. I confess I hadn't done so before preparing for this, but ensure that informed consumers hold the healthcare system accountable and that access to affordable and appropriate healthcare services through programs that serve as models for the nation. A really exciting vision. And the mission fits perfectly within what HSCRC is doing with the Plan for Health System Needs. Promoting the informed decision-making just so beautifully intersects with the consumer engagement piece of this, as does increasing accountability. and improving access in a rapidly changing healthcare environment to the timely and accurate information. So we are really, I think, well aligned with MHCC and HSCRC and other agencies, DHMH, to move this project forward, and in fact to create that statewide health and wellness campaign. And a critical piece of that is the education piece. And I do think that all of the agencies and other entities that are working on those multiple initiatives that we saw on an earlier slide really have an opportunity to do something exciting here, and by combining forces can leverage the resources of both the private and public sector to really make an improvement for Maryland and to educate our consumers. I think that the consumer engagement resources that you have now, the quality reports, as I said, so important in giving the information to the consumer and making that information transparent. I know you're looking at other areas like that. Teresa's been absolutely fantastic on engaging the consumers, and on the front page of those quality reports is that link to how to file a complaint. This is so complicated for consumers, and the information we get from that process is critical to the decisions that you all and others are making in improving the model and access to health care writ large. So there also, I think, the sharing of metrics and data to drive policy. What comes from the all-payer claims database is a source, and obviously what's being done with the health information exchange. So I think there are really, really exciting opportunities across the board to move this forward. And again, I think the fact that we're a national model really sets us up to do some exciting things, and I personally think that we have a responsibility to do that and to carry through on that. So thank you very much for the opportunity.
Thank you, Lenny. Just a brief bookkeeping note. I think that all of the commissioners that are on have now been unmuted, but I just learned from Levon that perhaps Commissioner Montgomery may still be muted. Could we just do a test? Commissioner Montgomery, can you just indicate that we can hear you?
Sorry, quick update from Levon. Commissioner Montgomery, I think you haven't entered your audio pin. You must have redialed in, so if you do that, then you'll be able to speak.
Okay, all right. Thank you. So, thank you, Lenny. Questions from the commissioners first.
This is Diane. This is Commissioner Stollenberg. I just wanted to say I think this is excellent, and frankly, there's a big part of me that's breathing a sigh of relief. I've heard a little bit about these activities, but to see this in much more detail is certainly gratifying, and I would strongly encourage my fellow commissioners and also MHCC staff to take this to heart, to really think about how we can be a more aggressive partner in these important activities.
Thank you. Lenny?
Yeah, no, I just want to say thank you. I mean, there was a really bright, engaged group of people. Somebody said, Gary Vogan of Holy Cross Hospital said at the end that he'd been in many work groups and he'd never seen one that was so engaged. And I said, well, if you can't engage consumer advocates on consumer engagement, we're all in big trouble. So,
other questions? So I will ask you the same question I asked Vinny, which is, it's very comprehensive. With your recommendations, did you try to put some price tags on what that would take, recognizing that it would be implemented probably incrementally and through various funding sources, just as Vinny suggested?
Right. So let me say first that I think one of the most important things is that we ensure that there really is a well-coordinated communications campaign. One of the challenges with communications is when you're getting different messages from different sources. So But we did look at we did do some preliminary work on a budget, and it was it was, when you're looking at this writ large, it's a big ticket item, and I don't have the number in front of me, but I mean, I think we're looking at $1 million plus. Our job was not to create a communications plan, but rather to put in place the strategies that would drive the creation of that communications plan. And we got the same, obviously, Ben, when we presented to the HSCRC commissioners. I think it's important to remember, and Vinny's example demonstrates this, that obviously there needs to be a commitment from the state to this, resources from those areas, but there are multiple agencies, again, who have some skin in the game on this, but there are also opportunities, again, in part because we are a national model, for funders in the private sector to participate as well. So I think that there's a need for creative thinking, leveraging the resources that are here. Please do not reinvent any wheels. That's just a waste of dollars. But I think that, again, I think there's a tremendous opportunity, and we need to take advantage of this, and we need to take advantage of it soon. We can't sit around for 12 months and try to figure this out, but we need to get the train moving, so to speak, on how we're going to make this happen.
Vinny, you want? Go ahead.
Yeah, just I agree completely with Lenny that we need to get moving, and that's why I think this LifeBridge pilot of the State Community Health Network is a great way to begin health system transformation and consumer involvement right now. And we are working closely with them and the HSCRC to roll it out in a way that will really let the public know that something big is happening.
So I think that might be a segue to my the thought I had when I realized there were really two work groups, is how do these two initiatives really relate to each other? I think I see some synergies, but I'd like to hear from the leaders of both on what your thoughts are. I think that'd probably be a question that commissioners would want to know too. In parallel, you've talked a lot about collaboration, but clearly, I think our consumer engagement initiatives need to work together first off.
Yeah, no, again, I will go back and say that I think it's absolutely imperative when you're looking at the consumer engagement and communication piece that there be complete integration and a single message. And although I think we need to get moving on this, I also think that you don't want to leap into the water before you know what you're talking about. And having a sexy name would help. But personally, I work under the aegis of the HSCRC. I might have done things differently if I was wearing my own hat. And so I believe in collaboration. That's how our coalition works. But personally, I think this is a question for HSCRC and what they're going to do with the report of the 12 people that put it forward. So I would pass the baton to Steve and put him on the spot, and he can then punt it.
Maybe before we ask Steve, ask Vinny for his thoughts as well, then Steve can respond.
Well, we started this with, as Donna requested, that we create the Consumer Outreach Task Force, working closely with Maryland Hospital Association with 3 goals: to do focus groups on how to talk about health system transformation, which I think those focus groups give us good advice, and a new day for healthcare in Maryland is a good way to begin that. We did the forums, and the third was the Faith Community Health Network, and we're working closely with the HSCRC to implement it, and I think that everybody's going to see that this is going to be a great way to educate the public about what's happening in Maryland.
Steve, using Lenny's words, we're putting you on the spot.
So I want to also thank Lenny and Vinny. They put a significant amount of time into this. We've learned a lot. This has been a give and take on both ends. We were trying to educate people, but we were educated as well through this process, and appreciate that. We find significant value in both of these reports that we have, and obviously some take different. One takes a different tact, and with priorities on the faith-based initiative, and others, and Lenny's is focused on really looking at the mission and vision and where we should be going. And as Vinny said, with kind of let's get going with some things that we can do right now. The commission has already begun. We took these recommendations, all of them, and already begun to work with the department. As you can see, these recommendations are much broader than the HSCRC. There are a couple things that are very specific to the HSCRC, but it's much broader. And almost everything we do, Teresa and MHCC is involved with this. And as Lenny mentioned, I think your website is a really good start, and I credit Teresa with all the time and effort that she put into that. So we're beginning to work with the HMH and MHCC and others to think about what the next phase will be for a campaign. But I think also what Lenny said is critical, is that the message has to be coherent, and it has to be one message. We can't have various messages out there. And I think both the folks in this room, both the leaders of the task forces will tell you that's important as well. So that's one of the things that I think we as a state could do, is try to merge whatever the messaging to make sure that it's a singular message that is coherent and that is meaningful and useful to consumers in the industry.
Thank you.
Is there time for one more question?
Sure.
So wonderful information, excellent work. I have a question about measuring success and pivoting approach during the implementation phase. And I'm not sure if it's to both of you or one of you, but how do you propose to measure success during the rollout, where you might say, we'll put more energy, let's pivot and put more energy in one place or another? Any reaction?
It's a good question. We, as I said, had these grants to 4 foundations, and one of them we've received, 3 others we're likely to get, to do this pilot with LifeBridge. Embedded in that is an evaluation program. And the Urban Institute, including Stan Dorn, who many of you know, will do an evaluation of this Faith Community Health Network project with LifeBridge. So we're going to have a very solid evaluation of that as a way for other hospitals to implement it. So that's number one. Number two, I want to emphasize that we've already had evaluation success in having 800 people come to these forums, who themselves represent the people talking about what they want health system transformation to look like in Maryland. And our next step is to continue engaging them through other forums and other ways. So I think we've already had tremendous success in reaching consumers, but we're going to have some more solid numbers from the Faith Community Health Network project through the Urban Institute, and we're going to build on these forums to continue to reach these people.
Thank you.
So I think I'd ask you back, when you're talking about success, are you talking about success in reaching the waiver markers, and how the consumer engagement piece has driven that, or are you talking about success in a different form, as Vinny addressed the specific initiatives he's working on?
Great point for clarification. I would think of it more along the lines of educating consumers to help drive to reach the ultimate goal, which is that which the new day for Maryland healthcare. I think that's more the approach, because there's so much great work going on. Can you be attributed to one more than the other? And how would you measure one area that seems more effective to say it's time to pivot more energy here and less there along the journey? Because dividing and conquering is great, but at some point it begins to have a point of diminishing return, I suppose.
Yeah, no, I mean, it's very challenging, and I think the hardest part of what we did was looking at the measures. So for one example, the issue of improving the rate of those who are doing advanced directive planning. If we are doing effective consumer engagement, we would be getting more of these conversations with doctors, completed and having more of the paperwork done, if I can put it that way. So in that area, for example, we looked at the fact that Medicare is considering reimbursing for those conversations, end-of-life conversations. If that goes through, we'll have a code that can be tracked. So, but the problem with all of this is that right now there are very few metrics for consumer engagement. So I think that part of our job is, as we started to do with this, with Diane and Teresa and Steve, was look at what is being collected now. I know I've had a conversation with Shule and Steve about the data collection for the waiver, and it's going to take a lot of thought and work, I think, to come up with what those metrics are over the course of this. And I think the first thing is to identify, to go through, for instance, the report, the measures and strategies we put together, and say, you know, will this do it? Are there others? Expand upon this and go from there. I don't know if that answers your question, David, but hopefully so.
Thank you.
Let me just add, after these couple of years with the LifeBridge project, we're going to have some very detailed data on were people in the Faith Community Health Network, was their health better? Did the hospital save money? How many liaisons were involved? How many consumers were actually involved in helping other consumers? We're going to have some really good data on how this project works. And in addition, we're going to have, assuming we can continue with the forums, we're going to have some really good data on additional people besides these 800 who've been engaged into the process, and how many of these people, for example, the NAACP was very much involved in these forums, and they reached out to all of their constituents across the state to let them know. We're going to track all that. So we're going to have some very good data on how what we're doing is keeping people healthy and reducing healthcare costs and getting consumers very much involved in the process.
Thank you.
So, Commissioners, we're nearly at the end of our time. I'll pause one more time to see if there are any further questions from those on the line.
Can I just interject, Ben, that on All Things Considered today, I understand they're going to be doing a program on the waiver. So that should be interesting.
So it's a little awkward for anyone to come before us to suggest a creative name. Recall that MHCC divides the Comprehensive Standard Health Benefit Plan and the Health Services Cost Review Commission, expecting them to come up with a creative name, given their name might be more than the heart, the mind can bear. But I would leave you, since you mentioned the waiver today, that we did have a suggestion from one independent commissioner at the Maryland Health Benefit Exchange that we brand everything in Maryland on something that is enormously prideful to everyone here in the state, which is the Free State, which is, I think, does to me seem somewhat anchoring to everyone, that we can all celebrate the fact that Maryland is the Free State, and it has a couple different meanings over the history of the state, but I haven't heard widespread endorsement of that idea. But I would note that in Vermont, the Green Mountain Health Authority does seem to be gaining some traction as well, and a simple message that everyone can salute, I think, is an important message that everyone ought to take to heart, because sometimes very simple stories, alignment, convergence, working together are really ways that everyone can get started on this path. So with that last comment, I want to thank both of our presenters.
Thank you very much.
As well as our colleague from HSCRC, all the commissioners that are dialed in today, as well as those that will access the presentation on YouTube in the evening hours or at their leisure. And thank you very much. And we look forward to working with both of the groups, bringing them together, as well as MHCC, HSCRC, and other state stakeholders. Thank you very much.